Well, I think we're getting started, everybody. So it's 9:31, and I want to say welcome to the first Partnership for Fit Kentucky webinar. I'm Dr. Alison Gustafson. I'm an associate professor here at the University of Kentucky. And my work over the past 10 years has definitely been around the built environment and how that can influence people's dietary choices and physical activity. And so I'm going to get started with our slideshow. I'm just going to exit there out of full screen. Let's see. Okay, so most of you might know where our grant funding came from, but just in case, I'd like to give a little bit of context. So the Centers for Disease Control and Prevention gave funding through the High Obesity Program, 1809, or HOP. So this is actually our second round as far as the University of Kentucky goes. So we are in round 2, and it's a focus on environmental and structural changes to improve health outcomes. And those health outcomes that we're primarily focused on are fruit and vegetable intake and daily physical activity. The first round, we were in 6 counties in Kentucky, and the eligibility criteria, if you will, was having an obesity rate greater than 40%. So I like to say that it was good news that in the second round, there were only 2 counties that were eligible. And through various factors, Martin County was the main county that we are doing all of our work. And a big factor is also the collaboration with our cooperative extension associates and agents in these counties. So in our project, we're focusing on the following key areas to target: fruit and vegetable intake and daily physical activity. We're working with the faith-based community to improve environmental changes within those organizations. We are working with grocery stores, convenience stores, gas stations, and food pantries to improve product offerings and access to healthy food. We are also reaching new and emerging farmers to build farmer capacity. And we're lastly establishing a connectivity plan to build infrastructure to allow walking to everyday destinations. I'm going to footnote really fast here on that third bullet point where we talk about reaching new and emerging farmers. There's quite a bit of literature out there that has shown farmers are aging, and there's not enough new and young farmers, if you will, to replace the old farmers that are retiring. And we definitely saw this through our work at farmers markets over in the summer. And so that's a passion area of mine that I worked on for the past 15 years, is how do we get new and young farmers to enter the field, but how do we also make farming sustainable in our country? So we won't be talking about that today, but that's also an area that I have great interest in. Without farmers, there is no food. And so it's something just to think about. Okay. So I just like to give this graphic, which I did not create, our study team did, but I just love this graphic. So this was at the end of year 1. We had $269 were spent by kids on fresh fruits and vegetables at a local Kentucky Farmers Market Pop Club. Farmers participated in Pop Club, offering kids healthier and accessible snack options. There were 664 total pounds of produce. So there, again, we're not going to be focusing on that today, but I'd like to keep that key point in the back of your mind that if we can improve access to fresh fruits and vegetables for kids and families, they will purchase it with incentives, and structural changes for our farmers as well. And so I think at the end, I'll bring up the point of remembering how farmers are integral and how I'd like to see us connecting farmers with our food banks in the next stages. As we mentioned, the Faithful Families, we had 2 local churches that we partnered with, and they did a 9-week series connecting faith and healthy living. We have 13 community partnerships. And one thing that's key in any community-based grant is that there's community engagement and involvement, and that they are an integral partner in any type of community-based intervention programming. So I've been doing community intervention work for the past 20 years, And overall, one thing that's clear is that top-down never works. No one wants the University of Kentucky coming into their neighborhoods and communities and telling them how they should live their life. So we have a community coalition, which is made up of anywhere from 7 to 12 pretty active members that help us guide the decision making. And so that eventually when we leave Martin County, when the funding is over, they have ownership of the changes and they have ownership of what takes place in their community. Then this last little heart with the fork and the spoon, this is ARO and and RAMP, which are the 2 food pantries. And this is what I'm going to be talking the most about today. And they'll receive upgraded refrigeration equipment that will allow them to reach and serve more food and secure families. So one of my favorite parts of this program is that it started with a refrigerator with these food pantries, and it's exploded from there. Just to give everyone a little bit of detail about what Martin County is like and who are the people that we're serving. This is a detail of the characteristics of our cohort study. So these people we recruited and they consented and enrolled to be in our baseline cohort. So there was 152 people within the county. And we had a mean age of 56 years. So again, think about that. If the mean age is 56 years, it's an aging population, and this represents very much so the rest of the nation as far as the aging goes. And so that's something to think about when we move forward with, are these people also grandparents? Are they taking care of their grandchildren? As they get older, are they having access with transportation that maybe they did have access to a car, but they don't anymore? And so that's definitely a variable that we need to keep in mind as we do future programming and intervention work. Probably not surprising that a majority, 65%, were female. However, we had quite a bit that were male that were responding to our survey. Most participants reported an annual household income less than $20,000. So we know that Martin County is a very high economically disadvantaged community, and thus the people we recruited represented that community. And close to 40% participated in SNAP, or the Supplemental Nutrition Assistance Program, and they received benefits within the last month. This survey was done actually over a year ago, and so now we're having our follow-up year 2 survey, but we don't have that data yet to share. Where did I go? There we go. Okay, so now we know kind of what Martin County is. We know why the CDC wants us to reach out to these high obesity counties. And so now I'm going to just focus on one aspect of the bigger CDC HOP grant. We started to work with food pantries. We knew from our food environment assessment that food pantries were an integral component, and that people are getting a lot of their food and food assistance programming from these. So again, if you look back, 40% of just our sample was reporting on SNAP. And that's definitely representative of what national data say as far as Martin and Eastern Appalachia. We know that anywhere from 30 to 40% participate in SNAP. So we have 3 primary food pantries that help serve Martin County or are located within Martin County. So we have Appalachia Reach Out, which is ARO. They average 75 families monthly that come in. The client choice shopping model, which means they can shop once per month per family. So they walk in, they pick out what food is it, obviously what's available, and then they shop for that food. Another food bank is called RAMP, that's that name, and they distribute to approximately 100 families, all in Martin County, and they get a USDA dietary guideline box approved once per month. So they don't have as much choice, if you will. It's pretty much standard based on the USDA. Now, obviously, it varies. The food items vary month to month depending on what is donated. Lastly, there's Helping Hands of Martin County, and this serves approximately 300 families monthly, and they also get a USDA box once per month. So we know that these food pantries get their food from food banks, right? Well, maybe some of you have been able to participate in a food bank donation. So when you think about that, what are the most frequently foods donated to food banks? Shelf stable, high carbohydrate types of items, right? Mac and cheese. Everyone loves to donate boxes of mac and cheese. Everyone loves to donate boxes of beans or cans of beans. And so we think that this is a great avenue, given the amount of families that these food banks are reaching, is a great avenue for how to improve food access and meet food service guidelines based on the CDC. Martin County, though, is considered a split county. It's very long. And so there's 2 pantries that are serviced by God's Food Pantry, and so which comes out of Lexington. So Martin County is about 2.5 hours drive from Lexington. And so if you think about that, it's really hard to drive milk, or it's really hard to drive fresh fruits and vegetables. And so we need to think about that food system and how transportation can be such a barrier. One pantry is actually serviced by Facing Hunger, which is out of Huntington, West Virginia. So just to give, again, context, that Martin County is actually closer to sometimes West Virginia facilities and resources than they are to anywhere from like Louisville or Lexington or those bigger cities. So we have facilitated partnerships with regional food banks to be kept abreast of services to county food pantries, including mobile distributions. So we know that it's very important that we keep these partnerships at play so that we can improve the access to healthy items for these various food pantries. Okay, so now we know about mobile food distributions that we've learned during the past year, especially with COVID. So mobile distributions from both food banks ramped up due to COVID-19. I'm sure most of you have heard in the news and the media the rate of food insecurity has skyrocketed due to COVID-19. As an anecdote, I know that in many of our military bases, we've seen a huge increase in food insecurity among the men and women that are serving our country. And that's just one example. People who are already food insecure have also seen an increase in their rates as well. And Martin County has definitely been impacted by that. So we know that those served in Martin County in the summer and fall of 2020 has just increased exponentially. So Facing Hunger, in partnership with the Helping Hands Pantry of Martin County, they've had an increase in distribution in August of 2020 of 561 individuals. Now that might be somewhat up due to reporting, and it also might be due to the surge in COVID. But we've seen a steady holding at about 200 households from October to now, with 190 and then 185 and 190. So you think as a percentage of the population in Martin County, that's anywhere from 5 to 10%, just kind of depending on your Census Bureau data. And so this is such a key component for how to improve food access and healthy food exposure for these families. If this is how they're getting, even 5 to 7% of their calories per month, we want to make sure that it's nutrient dense. We also know through these partnerships that we've established with this grant that God's Pantry with Appalachia Reach Out. So remember, that was the food bank that was called ARO. In August, they distributed 11,000 pounds of fresh produce to approximately 300 families. So I think this is such a key collaboration, is that we're working with our food banks and our food pantries to help improve access, to help improve the distribution channels. And I know sometimes that can be very daunting. I've done this work, for a while now, and it's hard to make these partnerships and these connections. But what we also see is when we when we, boots on the ground and we make that work happen, we really can serve a lot of families, and we can serve them fresh produce, and people will take it and they will consume it. And we know that that's just such a great avenue. So obviously we anticipate additional distributions in 2021. Okay, so another key aspect, I'm just checking my time. Okay, another key aspect is the food pantry and summer feeding route. Some of you may do summer feeding programs through your work or through different grant work. And as we know, because of COVID, many kids are seeing an increase in food insecurity because they're not getting their meals from schools. So again, back to that food pantry, ARO, they partnered with the school food service director in Martin County to increase the reach of mobile summer feeding route to rural and remote areas in this underserved county. After 7 weeks, ARO was able to distribute over 7,000 meals. So I'm going to pause there and let's think about that from a food system perspective. We have the food pantry, and sometimes we can think of it in a very silo manner that people come, they go to their food bank, they pick out food, or sorry, they go to their food pantry, they pick out whatever food was distributed from the food bank, and they leave. But this is such a key example of the work that our study team, and I'll get into Rachel and Emily's work in a moment, that their study team, because we're helping to build these partnerships and make these connections, that they were then able to partner with the school food service director in Martin County and increase the distribution of those meals to kids that would normally not have that. And so this is a key access point for ARO to share information about their services to a new population that may not be aware of the organization, and that can only improve the distribution of food for our families. The last key point I want to talk about within the food bank partnerships is our community garden. So Grow Appalachia, which is a nonprofit, which has lots of arms throughout the state and is a great resource for those that aren't familiar with it. It partners with organizations, communities, and families in Appalachia to create vibrant and viable food systems through ag education, expansion, and gardening assistance. So this is where I'm going to come back to. If we remember how we said farmers are aging, there's not enough young farmers to come in. Well, this organization can really work with communities to help grow small gardens and then also help people grow their own small gardens. And we know that there's a cultural acceptability to people gardening back in Appalachia. And so I think this is a key aspect to tap into for community members, is that they can grow, teaching them the sustainability of a small garden within their own backyard. So we leveraged Martin County Cooperative Extension Office, and now we're entering the second year of funding through Grow Appalachia. There's 50 growers, and this is just a key connection, is that there was over 17,000 pounds of produce harvested for the 2020 season, all through partnering with our Grow Appalachia and expanding our community garden. So there's a community garden plan for 2021 for summer, and God willing, who knows with COVID, but God willing. And produce grown will be donated to summer feeding route and food pantries in the community. So this is really coming full circle, and our extension associates have been integral in seeing how these key points can be connected. So we have a community garden, the food bank is involved, they can then get that food donated to themselves, but it's also back to the summer feeding route. So it's thinking about it from a system perspective. It's not just thinking about it from, I'm going to have my one little garden and that's it, I just have tomatoes. It's really understanding how all these pieces are connected and how we can all leverage and help each other. So I want to end here with all the credit goes to our staff and partners. So specifically Rachel Gillespie, she's an extension associate on this grant and employed obviously at the University of Kentucky. And Emily DeWitt is also an extension associate and a key and employed by the University of Kentucky. And they both are integral to the success of this CDC HOP grant. And we would not have the connections and the community buy-in without these two young individuals. And lastly, we want to thank all of our cooperative extension agents in Martin County and beyond who've really realized the importance of this system level approach to combating food insecurity and improving our primary outcomes of fruit and vegetable intake. So if you want to reach out to any of those food pantries, there's ARO and it's Dwayne Mills, and there's RAMP and it's Derek Step, and then Helping Hands, which remember is technically in West Virginia, but they have reach that comes across the border. As I like to say, food insecurity doesn't only stay within our state borders, and that's the contact person for Helping Hands Martin County. So I'm going to end there, and I will leave it open for questions in the last 9 minutes.
Great, thank you so much. We actually have 3 questions already, and I will encourage everyone or remind you that you can type any questions you have into the question box, and I will read them for you. The first question is, what program did you use with Faithful Families, which I think was from your second slide?
That is actually, and I wish Heather, or the woman, the assistant professor is Dr. Heather Norman Bergdorf, and she is in charge of Faithful Families. And I can, if you email me, I can put you in touch with her and send you the exact curriculum. So it's an extension curriculum. And so I
Perfect.
can send that curriculum.
Wonderful. The next question is, you mentioned high rates of food insecurity on military bases. Where is that data coming from? And do you have any idea of what some of the factors are behind that?
Sure, I can send you the data. The reason I know is this is not this grant. I have a separate grant with a colleague, Jared McGirt, who's out of UNC Greensboro. And we are doing behavioral nudges at Army base, at military bases. So we're in Fort Bragg and Fort Campbell. And so this is documented through their food service director about the rates of food insecurity. So they ask these questions every 6 months among their employees. And they also actually have, this has been new to me, this world, they actually have food pantries on site on the military bases. And so they are seeing a huge increase among the children that live there, the spouses that live on the military base, and also among those with active members. That's what I was looking for, active members. So I can send you that data, and then I can also link you to the one article.
Thank you. So the next question is, did you provide any education or recipes, cooking and preparation along with the produce donations?
So that would definitely is a key point. So we have this large program called Plated Up, Kentucky Proud, and that's working with extension agents, and I can send you the link for that. And we've done tons of recipe development and recipe tasting through the Plated Up program, and we've partnered up at grocery stores and done that work, and that has actually been very successful. And so I think the next step is definitely trying to connect those dots with meal preparation about the food that is delivered, giving them assistance with meal preparation techniques that are affordable and easy. And so that is definitely a next step.
Thank you. Another question. Most of the food boxes that are prepared to give to the food pantry, this comment says that a lot of the foods are high in processed sugar or salt. Is there a healthier option for people to get in the food pantry?
Yeah, so that's what we've been working with. So if you can see like what we mentioned about connecting with these gardens, connecting with Grow Appalachia, with growers. So we have seen, and like as I said, those thousands of pounds of produce, we've seen that we've increased through these partnerships, that we've seen a huge increase in the amount of fresh produce that we're able to give our food pantry clients. But again, it's looking at it that we're not just relying on the food bank to give us food, that we're tapping into other resources within our community to improve the fruit and vegetable offering. And it's also, I mean, I would say anecdotally, when even as an individual, when you're thinking about donating to the food bank, don't just open your cupboard and think about what's you have left over. Go to the store and think about what you would want as an individual if you were given, a food extra food surplus. I wouldn't want, the nasty lima beans. I would want yummy black beans, and then I'd also want maybe, some canned peaches, and then also I'd want some fresh lettuce, right? And so I think that's key, is that we treat all the people participating in food assistance with the same dignity and respect that we would treat our neighbor.
Absolutely. Thank you. We do have a comment here from Heather, who has a little bit more information about Faithful Families. She wrote,
good. Thank you, Heather.
Faithful Families is a two-pronged program. One arm is in 9 direct education lessons, and one arm is in implementing policy systems and environmental changes in the church to support healthy behaviors. So thank you very much, Heather, for clarifying that. The next question, which is actually the last question I have for now, is what was the physical activity aspect of the grant?
Oh, yep. So that isn't what we were talking about today, but I'm happy to give you just a snippet. And then also if you email me, I can forward that email to Natalie Jones, who's the extension associate charge of our connectivity plan and all of our work around physical activity. So we developed, we created a connectivity plan for Martin County, which would help create walking trails and sidewalks to everyday destinations. And so after that, and that was a year-long process, and we worked with the key stakeholders like the mayor, and, engineering, transportation, out of actually Kentucky Department of Public Health, Troy. And so we then are putting forward the connectivity plan to all the, again, like the mayor and the key stakeholders, to say what is the next steps moving forward for how to build sidewalks and how to improve the walking trails. In addition, we have a program, it's an extension developed and funded program called Fit Blue, and it's an app, and it encourages people to get moving daily. And so Martin County has been part of the Fit Blue program to get people to just do everyday movement. And then in addition, we've done a story walk between the library, and so I can have Natalie give the details on that, but there's a trail, and so there's story walk signs, and it encourages the connection between the library and then also with walking. So you read a book and then you walk around to all the different signs, and we're getting the concrete poured and putting those signs in for the actual story walk, hopefully sometime this spring. I could have a whole other presentation just on the physical activity. So if you want more information, like I said, it's just email me and I'll put you in touch with Natalie.
Great, thank you so much. We are out of questions for right now, although I'm sure there are still many people processing all of the great information that you shared. We are right at time almost, so I will cut it short there. But if anybody has any more questions, Dr. Gustafson has said she's more than happy to answer those if you want to email her. And you can also email the State Physical Activity and Nutrition Program at fitky@ky.gov, and we will be happy to try to connect you with whatever resources or answers you are looking for. As of a few reminders on the housekeeping items, you can download the slides you just saw from the handouts tab, and you should also look for an email with a recording of this webinar and a survey link where you can give us some feedback on what you thought of today's webinar and what we can do for future events. So with that, I think we will call it a day. Thank you all so much for joining us.
Thank you, everyone.